In honor of Veterans Day, it's important to focus on the health challenges many of our veterans experience. From managing physical injuries to the mental toll of service, our veterans deserve our support. Today, we are joined by Dr. Jolene Cannady with Cone Health Chrisman Family Practice, here to talk about common health conditions and health risk veterans face and what we as a community can do to help. So we're going to start right here. What are some of the most common health conditions veterans are at higher risk for?
So this depends on the period of time that they served, and we have different periods. So right now in the World War II and Korean War veterans, we see them aging, and we still do have some World War II veterans out there. And with aging, we're starting to see dementia, which can be difficult for families because they may share stories that they've never shared before with families. And so families may hear things that they necessarily might not have heard before. If we enter into our Vietnam veterans, they're the ones who had the risk for Agent Orange exposure. So then in that population, we see diabetes, hypertension, and multiple different cancers that are related to that specific exposure. And then from the generations starting from Vietnam War to present, we see more of the traumatic brain injuries, which we've studied more over the years. And then also various chemical and environmental exposures that place them at higher risk for cancer. In fact, they are twice as likely to develop ALS, and we also see neuropathy, fibromyalgia, and chronic fatigue syndrome more in that population.
Sure, and going on more with the toxins during service, what should veterans watch out for and how important are regular health screenings?
So I am a big proponent for preventative medicine. So for my veterans, I feel like they should go for annual exams and definitely ensure they are up to date on all necessary screenings, especially cancer screenings. And then they should watch for some of those signs that may show that they are having issues in regards to cancer or other health issues. So things like unexpected weight loss, night sweats, persistent fevers, difficulty breathing, irregular heartbeats, muscle weakness or spasms, and then just a natural increase in fatigue. So these are things they should watch out for, but as well go for their preventative screenings.
Are there unique challenges older veterans may be experiencing that we should be aware of?
So for the older veterans, especially when we're looking at our Korean War, World War II veterans, like I said earlier, we're seeing more dementia, and this is something I've seen in my practice. So these are populations that might not necessarily have shared their stories with their families. They were a little more quiet about that. And so I do find that when dementia starts, they do start to share those stories more as they go back in time. So they may have more flashbacks to wartime. They may be very scared of loud noises, and this can be very challenging for caregivers. So I definitely recommend caregivers reach out for assistance whenever needed.
And post-traumatic stress disorder can impact veterans. What are signs that may indicate someone may be struggling with PTSD that families and friends should, of course, watch out for?
So some of the big things I tell families and friends to watch out for are things like flashbacks. So this could be while they're awake. Something like a loud noise could set that off, or they might be having nightmares while they're sleeping, and that can wake family members up. If while they're awake, it can be a trigger event. Like I had one patient one time tell me it was fireworks that caused him to have a very big panic attack, and he had to leave that event just because the fireworks kind of brought on a flashback for him. And then they can have an increase in negative thoughts. So they may not be as interested in doing things they once enjoyed. And they can start blaming themselves or others for just events that have happened. And then they can start avoiding people and events. And then the last thing is that they can get very hyper aroused. So where the brain is constantly on and they don't relax. So they have difficulty sleeping. When they're out, they may be fearful of the surroundings, and they may become more irritable, especially if something happens to trigger those memories.
And transitioning back into civilian life can be tough. Talk about that and how family members and friends can help veterans through this process.
So the one thing I hear from veterans a lot is that they would like family members and friends to let them do it on their terms and not necessarily ask them what happened overseas, to let them share their stories on their own terms. And so in the military, they're trained to be very hypervigilant. So when they return home to a place where they don't have to assess anymore and constantly look for threats, that can be very challenging for them. And then there also may be some grief over losing some of their fellow members, and also grief over losing that very structured environment where they knew their role. So now they come back into civilian society and they have to learn a new role, which can be very difficult. And then the big thing I tell family members is just to support them and encourage them to take step forwards and understand that if they don't express emotions for a while, that's okay. Because in the military, they're trained to kind of repress those emotions, just because if they could get in danger in certain situations if those emotions are let out.
Okay, well, we will pause our conversation here. Again, we are talking about veterans' health on this Veterans Day and how you can help as a family member or, of course, a friend. We'll be right back.